Okay, so getting on to SALTAPS now. So with first aid, you've got to think about one of the last injuries you have. What did you see? Was it safe to approach and go and help? Were there other things going on around? Could you easily tell what had happened to the person? Could you diagnose their injury? And how did that injured person respond when you were trying to talk to them? So let's see what we can do with that. So we use a thing called SALTAPS. Now the first thing we do is, if a player gets injured, we stop what we're doing. Very straightforward. If it's in the middle of a game, player breaks their leg, we don't want to keep on playing around them. Next, we're going to ask them, how do you feel? What do you think might have happened? So that's our next one. We're going to ask them what's going on. So we can then, if they say this is the worst pain I've ever felt in my life, you know that it could be quite severe. Right, now we're going to look. If there is a bone sticking out of their leg, we know that it is an open fracture, as talking before. Or if there's a deformity. For example, if their finger is going the wrong way, we know that might be dislocated. Also, we can look for bleeding or swelling. So we've done our look there. Looking on to touch. So now this is only if really the player allows it. We have it here. So if it's not too serious and the player doesn't mind, you have to talk them through it and say you're just going to touch to see how it feels. If they allow you and then you touch something and it hurts, you then may have a good idea about where their injury is and what it actually is. Okay. So if we've gone through that, we can then ask them, can you move it? If they can move it, we know from before that means it is not a fracture. It could be a very hairline or a small one, but it's not a full-on fracture. So, if they can move it a little bit, but not with a full range of movement, we know that there is an injury there. The next bit is passively move the area. So, can you, as the first aider, then actually move the affected area yourself? For example, if a person's complaining of elbow pain and you gently lift their hand up, so here's the elbow with their hand, and you just help move that arm up, you can then look to see if there's any pain there. And then if that's doing, you can do a bit more of a strength test, and then you could perhaps push down onto that arm and say, right, can you pull up against me if it's not in too much pain and they think they might be able to try it. And that essentially is SALTAPS. Stop, ask, look, touch. Active, can they move it? Passive, can you can you move it yourself? And strength, do you have your original strength that you had before you had the injury? So moving on is for a few injuries, and for example a strain or a sprain, and we have protect. So you want to protect that injury, make sure they don't do any more. If you followed SALTAPS and you stop them, that's one way of preventing further injury or making things worse. You want them to get to rest it, so don't put too much weight on it. Perhaps they don't continue to play, so then healing can begin. You then apply ice. So this reduces inflammation, which to start with is a good thing, inflammation. However, it can cause pain and discomfort and not be too beneficial to the person, so it's no longer needed. So using ice will reduce that. Also, compressing the area using a bandage or a tuber grip can reduce that swelling that can be causing pain. Elevation. Elevate the injured area, and so if we put our leg up, here's our leg, and he's got an injured ankle, then that swelling and tissue fluid is going to drain out of that affected area and reduce the swelling. And the D stands for diagnosis by a professional. Go get the doctor or physio to then say what the injury actually is, so then proper treatment can be given. And that concludes our video. So I will see you in class. You need to know difference between soft tissue and a hard tissue, examples of fractures, dislocations and concussions, and what SALTAPS and PRICED mean. So I will see you in lesson. Goodbye.